I'm going to ask you this way. Could it be partly because in East Asia, our social fabric is such that we understand individual rights, but we often make a decision to subjugate that to societal rights. Do you think that that's the big difference that's happened? Why we could impose what was this initially called draconian measures, as opposed in Europe, in the States, because the freedom of individual rights it's very strong. It's not easy for governments either to message this right from the beginning. Do you think that has got any bearing on all this?
Absolutely. It is very much an Eastern culture where I will sacrifice my oneself for the greater good. In fact, they have a Chinese phrase for it: 牺牲小我，完成大我. To sacrifice the smaller in me, okay, to actually achieve the greatness in the bigger me. In this case, it would be society. So the need for sacrifice, the need to actually give up one's own personal freedom has been taught much in textbooks, has been displayed in societal values, and has been inculcated from seniors to juniors. It is in a way expected. And these measures help the society to accept political wills, political instructions, which comes down from the top. It makes it more palatable and easier to appreciate.
Because it is very difficult this time for governments to actually impose, because they know their own electorate, but at the same time, in that way, it's a blessing. We are more obedient. No one has given us any playbook. So even if, as long as we stick together, we'll get around it. And what you're suggesting is that it's true. Our Asian mentality has been such that it's a lot easier on the ground level and societal level.
Yes, it is. We are very much in tune with this. I guess it will be another 100 years or a century before this ingrained doctrination is eroded. But for this moment, it has played its part very well. And you can see from the Eastern countries, Asia Pacific, all of us do play this book very well. I want to give a special mention to the Japanese.
Yes.
The Japanese, ever since they had a bad flu at about the time of World War II, realized how important it was to wear a surgical mask. They also realized that if I was sick and I were to travel out without a mask, I risk infecting other people. This is indoctrinated into them for the last 60 to 80 years. So you realize, even though Japan was cold, Japan had cases of COVID-19, the rise which they have every day or every week wasn't as steep, even compared to Singapore, Hong Kong or Taiwan. They were very controlled. It was nowhere like the Europeans, because they had a good system of social distancing. They're aware about the risk of transmission. They have a culture of wearing a mask.
Yes.
Everywhere else in Eastern Asia or Southeast Asia, if you wear a mask, people will avoid you like the plague.
That's right.
People will think that you have the Hansen's disease or leprosy. But in Japan, when you wear a mask this way, it's understood that I'm doing this to protect you.
It's a polite gesture.
It's a polite gesture. And that is the norm. Okay, so this perhaps will be the new normal in future. And honestly, from the infectious disease point of view, it is a good habit to actually mask up and not go out, or if you have to go out, take special care. So I look after the person next to me, I do not infect the others.
Right now, many people are feeling it because, honestly, businesses are shutting down. It's very easy to tell people, stay calm.
Yes.
But what do you think? How can people cope, and what do you see the problems that's going to come, in fact, even now?
We have to accept realities. Realities that life's going to be different. You may not be able to do things that we used to do before, or afford things that we used to afford before, at least not for some time again, right? But I think what I would like to do when I do this exercise is that I would like to help people to be able to prioritize what is really more important in their lives.
Yes.
begin to see things that they probably never saw before because they've been so busy working, they've been so busy paying the bills, the loans, the mortgages and everything, but they don't realize that, in their own life in itself, it's a gift.
Yes.
The ability to be able to be here, yes, right, it's a gift.
alive.
That's right. And then to look around and say, hey, I've got family, I've got friends, and we look at life and to remeasure things and to reprioritize things and to give value to things that are so much more valuable, right, that we have not recognized in the past. So I think if we can do that transition too, we can begin to see, look, we can take everything away from me. I mean, of course, it's very tough and we don't want to take away the pain, the fears and the struggles and everything and the adjustments. But, I'll be able to sit down and say, but you can't take my friend. You can't take my family. Yeah? They're always going to be with me.
Yes, and in many ways, this is a wake-up call for, sometimes we run around in life not realizing what really matters.
Exactly.
But it takes a death of a loved one, a separation, something bad. But in this case, number one, we're all in it together anyway. I mean, all of us, the whole Singapore, the whole region, ASEAN, the whole world. And in many ways, we can all just take a step back and go, what's the most important in the end? Because we have to face it.
Well, that's the truth, isn't it? And so when you begin to look at life and you look at the fragility of life, it actually gives us that purpose. I remember the late Steve Jobs, I think in his lecture in Stanford, right, his alumni, he actually said this, and I think people didn't know, at least I don't know whether that's the case, but people didn't know that he was suffering from cancer, or at least few knew. And I remember he made this phrase and it made me sit up, and he actually said this, he said, death gives meaning to life.
Yes.
And it's an oxymoron, the fact that we will all need to die, we definitely die, doesn't matter who we are, what we are doing and everything, actually gives us a sense of purpose and we begin to look at it, I think we begin to evaluate things. We spend a super inordinate amount of time, right, amassing things that don't matter.
And don't matter to impress people you don't care about.
Yeah. So let's talk about wealth. I mean, not that wealth is bad or wrong in itself, but it doesn't follow.
It's a means. It's a means to the end.
That's right.
And the means to the end is relationships, family, who you really are, isn't it?
Yeah. So as long as at the end, I believe the government is aware. I believe that governments are aware. As long as the end, there is that safety net that sits down and says, look, I may not have a lot of things, but I'm not going to be on the streets with my family and my kids walking around.
Yes.
Because I'm going to have somewhere that I can sleep still, some things that I can do. And then also a safety net just sits there and says, look, I may not be able to go to a fancy restaurant, but listen, you're going to get your 3 square meals, it's going to be on the table, no one's going to starve to death. I think you take those foundations, those basics in, I think, we then begin to rest comforted to know, right, the rest of it, we'll have to adapt.
Yes.
Yeah?
And I know you feel very deeply for the healthcare workers. Between us, it's a bit hard to contain it in. But you have written some beautiful poems about it that are meant to encourage and also to tell healthcare workers in Singapore and literally all over the world how much what is happening means, and there's some of us that really, really understand it. I really like you to read out maybe one of the poems.
I wrote this poem, a tribute to the emergency department doctors, quite a few months back. And it came to mind again recently when I was speaking to a colleague. My heart and my prayers are really with them. They're really at the front line. And a lot of them during this COVID period have taken on extra shifts, have worked tirelessly, have given up, extra days of rest. And it's very intense for them.
Yes.
As a thank you note to my emergency department colleagues, I've written this poem as a tribute to them, and I'll read it now. A tribute to ED. ED in short is short for emergency department. Unsung heroes at the forefront of every hospital. Focused, steady, clear vision, undaunted, unshaken, anchored as a team, ready, prepared, weathered by uncertainty, sudden emergencies, trauma, crisis, intense moments, the 7 a.m. phenomenon, quiet midnights, fingers crossed, yet surprised daily by valor, courage, strength of the human spirit, and often unexpected joy, the huddle and handover, winding down, unsung heroes of the ED.